Working with Children Living in Poverty by Elizabeth Smoley. Challenges arise when working with young children of poverty, such as a lack of enriching learning experiences, decreased nutrition, toxic stress, and broken relationships. Early intervention programs assist in the repair of diminishing brain growth caused by poverty. There's a long running list of social safety net programs that empower families of poverty. Children of poverty are less likely to have access to good nutrition. As the family lives in extra stress caused by living in poverty, the child inevitably engages in fewer enriching learning experiences. The stress of poverty directs a survival fight just to meet basic needs. This fight hinders the relationship, especially the nurturing relationship between a baby and mother. For young children growing up in poverty, these adverse experiences can include decreased access to good nutrition, fewer enriching learning experiences, and heightened stress, which can impair the relationships that nurture a baby's development. Thus, the timing of a baby's experience with poverty is important because this rapid period of brain development makes them particularly sensitive to poverty's ill effects. These effects can follow them all through life, placing them at greater risk for later school failure, behavior problems, and health problems as an adult. Challenges arise when working with young children and families living in poverty. Poverty can put a child at risk for needing extra assistance to meet developmental standards and milestones. A child living in poverty, or even post-poverty's behavior may be flagged as difficult, as the child is processing that survival mode state of mind. Children living in poverty may have challenges accessing their executive higher level thinking. Their thinking and actions may be more on an emotional level. Mental health of a person living in poverty may minorly or severely be affected depending on their coping skills that the person has established. Nearly half of all American babies live in or near poverty. Inevitably, as an early child care professional, we will have a child living in poverty under our care. Understanding poverty may manifest in a young child through behavior issues in the classroom, health issues, and developmental delays is the first step in assisting a child in poverty to meet their fullest potential. Early intervention is crucial. All available information points to the same conclusion. Intervention in early years can make an important difference, but the magnitude of policy and program impacts must be increased. Screenings highlight areas a child needs resources or extra support. Just as a pediatrician mandatorily checks a patient's growth on charts, assesses eyes, nose, and mouth, and listens to the heartbeat to ensure no additional medical assistance is needed, early intervention programs screen if developmental benchmarks are being met and make referrals as needed. For example, a screening may indicate a child's fine motor and gross motor needs developing, and the child is also experiencing extreme meltdowns that interfere with concentration. An occupational therapist may be referred to provide additional assessments. When the process of an early intervention takes place prior to falling behind in school, strategies and plans can be implemented to assist the child meet his or her fullest potential. There are resources available for families. There is a social safety net to assist in bridging the poverty gap. This social safety net provides resources to those in need. Programs such as the Supplemental Nutrition Assistance Program, unemployment insurance, and the Earned Income Tax Credit help cushion the impact of recession and lift families out of poverty. Supplemental Nutrition for Women, Infants, and Children, WIC, provides special nutrition for pregnant women and babies. Temporary assistance for needy families provides income and other supports. Low-income housing emergency assistance helps keep small bodies warm. Childcare and early Head Start, which reaches only a handful of infants and toddlers, helps parents work and put babies and their families on the right path for positive early learning experiences. And the list goes on. Familiarizing yourself as an early child care professional with the list of resources available to those in need provides a foundation to tackle the poverty crisis that affects today's quality of early childhood education. Thank you for taking the time for my PowerPoint presentation, working with young children living in poverty.